Thank you for joining iMeet.
Review of Sustainability Group, June 13th.
This meeting is now being recorded.
We are, as you just heard, recording this meeting so that those who are unable to attend today will have access to the information as we move forward in this process, as well as being able to share this with others that those of you who may wish to invite to this group. So in the slide deck that was shared with you, there are iMeet web conferencing logistics. So I would like to just take some time to go through some of those housekeeping items. So with iMeet, this may be a new software package for many of you to be using. We have detailed instructions on how to join the meeting. You may either choose to use your phone or computer for the audio portion of that meeting. We prefer to use the phone because there seems to be less interference with the process. So hopefully everyone has been able to log in. If you haven't, feel free to use the slide deck that was emailed to you to follow along. We recommend that you use your browser. Often the first time in downloading the app, there's a delay in the process for accessing the desktop application. So everyone should have signed in with your first name, last name, and email and joined the meeting. As I described earlier, you can either choose to dial in, have iMeet call your number, or use your computer audio, but it's important not to be using the phone and computer audio at the same time because there is feedback. So on your home screen for iMeet, you will see several buttons, as we call them. So in the lower left-hand corner, you will see your list of participants. If you click on the people, you will see the list of participants that have joined the call. To the right of that is your chat box. We may communicate through this to you, and we encourage you to ask questions through this feature. And then the third item, the third icon is the notes section where you may take notes and email them to yourself. The connect and share screens would be if we were sharing, having someone else on the group present to us. We may use this in future when we're presenting best practices with other participants from other states. You can adjust the volume of your computer if you're using your computer, or the volume of what you're hearing through your speakers. And then all the way to the right is a menu, which is detailed on the next slide. So all the way to the left, you'll be able to see who is currently speaking. Right now, you should see HPC host, and then with my name, Gina Trignani-Kirk, speaking. If you would like to raise your hand, you would click on your name and then click the little person there with the raised hand, and that will let us know that you have a question and would like to speak. And we will invite you to ask your question or provide your feedback at that time. And again, you may also type any questions or comments, and then we will read them and respond to them during the session. Okay, so to see, these are some of the details that I've already described. In the section, you can also, the last menu section is where you would leave the meeting. You can edit your profile where you can provide some details, provide a picture, and adjust your settings or request iMeet help. So let's move on to the meeting structure. Before I move on to that, are there any questions related to the logistics of the meeting? Okay. So the Leadership Sustainability Group meeting structures will include introductions and roll call, of those who have responded to attend the meeting. There'll be a brief presentation of each topic, followed by group discussion, and then followed by topic-focused action planning that will inform the sustainability plan. We will follow up with a leadership sustainability group post-meeting survey to collect additional information and feedback on the process of the meeting, as well as any additional feedback or thoughts that you may have gathered following the meeting, or may not have felt comfortable sharing during the meeting. After that, Health Promotion Council as a team will be following up with the group to provide written feedback. There will be the recording of the session to share, and we will be incorporating the feedback into an ongoing process that will create the sustainability plan that the group will review and provide feedback on. So let's take an opportunity to see who is on the call at this time. I'm going to go ahead and go down the RSVP list and see who is on the call. Following my roll call, I will allow others who have not been called out to announce their name and organization. Do we have Alexandra Lorio from Erie County?
Yes, it's Iorio with an I, but yes, I'm
sorry.
here.
Thank you.
That's
Thank
okay.
you so much.
Thanks.
Camelia Rivera from the State Department of Health?
Yes, here.
Katrina Kyle from the State Department of Aging?
Here.
Melissa Jitsi from the Diabetes Action Network?
Here.
Patricia Booty from Gateway Health Plan? Patricia Davidson from Westchester University?
Here.
And also representing the American Association of Diabetes Educators at the state level.
Yes, that's correct.
Thank you. Diane Battaglia from UPMC. Diane Battaglia. Diane Charlton, Aetna.
Here.
Did I pronounce your name correctly?
Yes, Diana Charlton.
Charlton, okay, thank you. Deborah Hoffman from the Department of Human Services.
Here.
State level Department of Human Services. Thank you, Deborah.
That's,
Okay. And Michelle Foster from the American Diabetes Association.
Here.
Okay. And are there any others on the call at this time that I did not call? Please announce your name and your organization.
Hi, Gina. It's Donna Ball. Well, sorry.
Donna Baldi.
From Quality Insights.
Next.
Stacy Batia from Gateway.
Thank you, Stacy. Next.
Hi, Gina. This is Liz DiVietti from the U.S. Department of Health and Human Services.
Hi, Liz. Thank you. Next, please. Okay, so everyone on the call has had an opportunity to be recognized. Thank you all again. So today's meeting agenda will provide a brief introduction to Health Promotion Council, just so you know who we are, as well as a brief overview of the Pennsylvania Community Living Initiative. We won't go into depth on the initiative itself. We will be providing an overview that you can view following the meeting. Thirdly, we will go through the leadership sustainability objectives, governing principles, roles, and responsibilities, review the meeting schedule for the leadership sustainability group, provide a brief overview of the leadership meeting topics, have a time for discussion, summarize action steps, and then adjourn the meeting. Does anyone wish to provide any feedback on the agenda? Okay, well then let's get started. Thank you. So about Health Promotion Council, we're a nonprofit organization located in southeastern Pennsylvania in Philadelphia proper. Our mission is to promote health and prevent and manage chronic diseases, especially among vulnerable populations, through community-based outreach, education, and advocacy. We have over 30 years of experience in community-based health education and outreach, reaching over 40,000 lives, especially among vulnerable populations. And our mission is fulfilled through three specific areas: through the provision of direct services, through capacity building efforts such as this, and policy and systems change work at both the local and the state level. We are an affiliate of Public Health Management Corporation, which is a public health institute in Pennsylvania, as a member of the National Network of Public Health Institutes that offers over 350 programs and services in southeastern Pennsylvania, statewide, and actually nationally through some of its affiliates. So to provide some background on Pennsylvania Community Living Initiative, this initiative is led by Health Promotion Council through funding from the Administration for Community Living for the funding period of September 1st, 2015 through August 31st, 2017. It involves diverse partnerships and stakeholders in Pennsylvania, and the aim is to build capacity to deliver the Steps for Healthier Living Diabetes Self-Management Program, which is an evidence-based program originally developed at Stanford University. The other aim is to ensure the sustainability and expansion of programming beyond this grant period. And as I mentioned earlier, we will be providing a more detailed overview of Pennsylvania Community Living following this meeting, which will be available as a recorded webinar or presentation. The goals of Pennsylvania Community Living Initiative are to, firstly, expand the infrastructure and capacity to offer diabetes self-management programming, as well as other chronic disease self-management programs in the suite of programs available. To integrate diabetes self-management programs into healthcare and community-based delivery systems as long-term sustainable programming throughout the network. 3, to improve older adults and adults with disabilities' ability to manage their diabetes and other chronic diseases. 4, to create innovative funding solutions for the Pennsylvania Community Living Initiative. And 5th, to establish a leadership sustainability group to develop the sustainability plan, which will incorporate goal number 4. The main outcomes for the project are to increase positive health and self-care behaviors among program participants, and to reduce the negative consequences of diabetes that result from poor self-management, such as complications, hospitalizations, and emergency department visits. The initial geographic reach for the project is, the goal is to have it be available statewide. Initially, as a part of the Administration for Community Living grant, it focused on the 3 circles, which are northeastern Pennsylvania, south central Pennsylvania, and southeastern Pennsylvania. And I've listed the counties that we were targeting in these 3 locations. The reason for focusing on these locations is mainly as a result of partners. We are partnering with AmeriHealth Caritas Pennsylvania, AmeriHealth Caritas Northeast, as well as Health Partners Plans, the Pennsylvania Department of Aging, Pennsylvania Department of Human Services, Pennsylvania Department of Health, Public Health Management Corporation Research and Evaluation Group is working with us, as well as a consultant gerontologist on making sure that we're reaching older adults and adults with disabilities in a culturally sensitive and appropriate way. And our disabilities outreach is mainly focused on Public Health Management Corporation's PersonLink organization. We've also added from the initial program initiation is Center in the Park in southeastern Pennsylvania, as well as United Neighborhood Centers in northeast Pennsylvania. So to describe what the evidence-based programming is, this programming is endorsed by National Council on Aging and the Administration for Community Living nationwide. It's one of the chosen suite of programs that can be used as a part of the grant proposal process. It is an evidence-based curriculum and program from the Self-Mangement Resource Center, which was originally known as the Stanford Patient Education Research Center from Stanford University. The curriculum is based upon a 6-week workshop series. Each workshop or each session is 2.5 hours, offered once a week. And again, it's evidence-based, so we can't modify the structure of that program in any way. It is facilitated by 2 trained leaders, and for each disease state, so if we're speaking about diabetes, one leader must have diabetes or be a primary caregiver of a person with diabetes. They co-facilitate each workshop from a highly detailed curriculum that was originally developed at Stanford University, which is now the Self-Mangement Resource Center. These lay leaders are supervised by master trainers. Each workshop is ideally convened with 10 to 16 participants with type 2 diabetes or the specific chronic disease, depending upon which curriculum is utilized. Any questions so far? Each participant receives materials that were developed by Stanford University. And again, based on which program is being utilized, there's always a workbook and an accompanying CD, whether it's for relaxation or for exercise. And this is just a sample of what the workbook looks like. As a part of Health Promotion Council's Administration for Community Living grant, we are providing these resources to sites that are implementing these programs. The deliverables for this grant period are to deliver approximately 295 workshops across 81 implementation sites, reaching 4,500 participants. And these participants are older adults and adults with disabilities. And of those 4,500 participants, we are aiming to have 3,350 completers. Completers are those participants who have completed 4 out of 6 workshop sessions, and that is based on evidence. Okay, we're just changing some audio equipment. Can everyone hear me okay?
Yeah.
Okay, great. Thank you. So the other deliverable is to make sure that we have an adequate number of master trainers. The master trainers are those individuals that are trained by the Self-Mangement Resource Center, again formerly known as the Stanford Patient Education Research Center. Those master trainers are then trained lay leaders and supervised lay leaders that deliver the workshops in the community. We also want to maintain and have a process for ongoing recruitment of lay leaders. These are the key workforce to make sure that workshops can be delivered in the community setting. And then also to develop innovative funding solutions that will support this programming beyond the grant period. Requirements of the Self-Mangement Resource Center for programming: it requires a license with the Self-Mangement Resource Center. Right now, licenses are still with Stanford Patient Education Research Center. There are several licenses throughout the state of Pennsylvania. So the license gives us license to offer workshops and train lay leaders. And licenses can be expanded. The baseline license allows for the delivery of 100 workshops and 6 leader trainings. And that number can be expanded as needed. And then the license can also be expanded to offer multiple programs or multiple curricula. The baseline curricula is chronic disease self-management. It requires master trainers, as I mentioned before. Those are the individuals that train and supervise leaders. It requires a strong cohort of lay leaders. These are volunteer lay leaders or paid individuals that can be staff persons of an organization. We need sites for delivery, and the best places for these sites of delivery would be in the community. We need funds to purchase program supplies as well as to support staffing. There's an element of data collection and coordination. There are forms that are collected as a part of the delivery of this program from patients, and that measures their confidence in being able to manage their chronic condition following participation. There is a need for marketing and promotion and participant recruitment, as well as developing an integrated and sustainable program delivery system. So for the Leadership Sustainability Group that's a part of this grant period, we've tried to reach a broad spectrum of partners, and this is a representation of some of the partners that we've invited. We are going to ask you to think about other partners that we may not have included. We can share the partnership list following the call so that we can see, we can get assistance from you to make sure that we have representation from as a diverse group of organizations as possible. The objectives of the Leadership Sustainability Group, and this is taken from the materials that were sent out from Caitlin Lamb to the group. There are three main objectives. The group will be asked to advise, to vet, and prioritize sustainability strategies. The National Council on Aging provides us with significant resources around sustainability from the years of work that they've been doing this across the country and collecting best practices and successes from across the nation. So we will be sharing them with you to allow the group to make decisions on what will work best for Pennsylvania. 2, a big part of this, as I've mentioned, is ongoing fiscal sustainability of these programs. So we will be reviewing and discussing what these strategies may be, including all the various payment models that are coming forward in the healthcare field. And 3rd is to develop the sustainability plan, which is really a business plan for supporting this programming into the future. The governing principles mainly are focused on wanting participation and contributions from all of you to really create an environment that we can collect your input and your thoughts. We want it to be an open and transparent group that we can develop a commitment to really developing a plan that will work for Pennsylvania. The roles and responsibilities, firstly, is having attendance at the meeting. So we're asking those of you who are participating from organizations to have a primary person who will be attending and then an alternate representative if you are not able to attend on your own, and then to be able to share information back with your primary contact at your organization. We realize that this is a big commitment in a short period of time. So we're asking that you participate in 2 out of the 6 meetings that are scheduled. And if you're unable to attend the meetings or your alternate representative is able to not attend the meeting, that you listen to the recording and provide feedback in between. And as I mentioned before, we will be providing written action plans as a follow-up of the meeting, and we would like to obtain your feedback in between meetings, or at least by the end of the, when the sustainability plan is presented in meeting 5. We hope that you will all work collaboratively to guide the Pennsylvania Community Living Initiative sustainability discussion, as well as utilize your specific expertise and experience to analyze the information that's presented and help to contribute to strategies that will help provide the greatest impact on self-management, education, financing, and to inform our sustainability and business plan. And then moving along, once we develop the plan and have information, that you will help us disseminate information to your appropriate and respective partners, to share information on the work that you are doing across the state or possibly across the nation that may complement the work that we're doing in the state, and mainly to work collaboratively to increase efficiency of our work and to reduce duplication of services. And then in the end, we're hoping that many of you will serve an advisory role beyond August 31st to analyze and advise the implementation of the sustainability plan, and we will gather your feedback on how we will organize that process. Initially, we're thinking quarterly meetings to provide updates, as well as some written information in between. That's communicated via email or a web-based portal. I'd like to stop just for a moment for any feedback. So let's move on to the meeting schedule. So we have defined 6 meeting dates between now and the end of August. We realize this is a short period of time. We are experimenting with an expedited process so that we don't prolong the presentation of the materials, and that we can create a sustainability plan, recognizing that it's a living document that will be modified and updated as the needs of the state change. So we are in meeting 1 today. Meeting 2, I will go through some details following this slide on each of the meetings. So I want to direct your attention to meeting number 6. We will take a group conscious about which day works best for the final presentation, and we're leaving enough time between the first week of August and the presentation of that final plan to make any edits that we receive during meeting 5. And again, as I said, this is a living document, so even though we're calling it the final plan, it will be basically the culmination of our work and then moving forward to guide our process in moving forward. So we're in meeting 1. I think we've made it clear on what we're doing in meeting 1, which is just going over what the purpose and roles of the Leadership Sustainability Group are. In meeting number 2, we will go into detail around the cost analysis of self-management programs, as well as the cost-benefit analysis, really looking at return on investment and what various profiles look like for cost-benefit analysis in different settings, as well as the various reimbursement strategies that exist in today's market, as well as integrated care strategies and models that are coming forth. We will follow that meeting with a discussion and action items for follow-up research and action items that are needed, and then sharing the action items as a result of meeting number 2. So we invite you in follow-up to this meeting or now, again, in your chat bar to provide any feedback on things that you want to make sure are included in meeting number 2, or anything that we have left out, or any experts that you think we should reach out to in preparation for compiling the sustainability plan. Meeting number 3 will be an overview of best practices. I mentioned the National Council on Aging. There is the CDSME, which is Chronic Disease Self-Management Education Resource Center, which has compiled all the years of evidence and best practices into a resource center. We will be pulling from those best practices, as well as inviting other states to present their best practices to us in a webinar format. It may be a recorded webinar, and then having as many of those states that are presenting available as a live Q&A discussion session, so that we can talk about what do we want to consider for Pennsylvania and what might work best for Pennsylvania. Meeting number 4, as I mentioned, one of the requirements for sustainability is really having a solid marketing, promotion, and strategy for referrals for these programs. So again, we'll be presenting, drawing from the experience of the National Council on Aging and other states, pulling those best practices and successes to share with you all, followed by group discussion, again, identifying the action items, areas for additional research and inquiry, and then incorporating these strategies into the sustainability plan. Meeting 5 will focus on really discussing what we've collected for the sustainability plan. Our goal is to provide the draft plan to the group for review prior to the meeting. This meeting will be presenting the plan as a draft, and hopefully allowing sufficient time for discussion and recommendations. These revisions will be incorporated for the final presentation. And then we will be ending this expedited process with meeting 6, which is the final presentation of the plan as developed at that point. We will be presenting the summary of this final plan and then presenting what the next steps will be. So this is the time for us to share Leadership Sustainability Group representation and open the meeting up for discussion. If we can first talk about if anyone has any suggestions on who to invite that we may not have captured. And again, feel free to use your chat box, raise your hand, or speak up.
I'll start. This is Marlon Williams from HPC. First of all, thank you everyone for participating on the Leadership Sustainability Group, with the Leadership Sustainability Group. I don't have the list of participants in front of me, but when Gina was going through the roll call, I did see that there were some managed care organization representation as well as some of our state and local partners, but and please correct me if I'm wrong, what I didn't recall hearing much of was representation from healthcare partners. So healthcare providers, whether that be primary care providers or family physicians or clinical partners such as actual community-based clinics or FQHCs. We may want to invite some of those folks to the table to represent the care side of things. So you might want to consider getting some of those folks around the table.
Thank you, Marlon.
We do have a question from the chat room, and it's, are the YMCAs a potential partner?
Yes, absolutely. So this is a good opportunity to think far and wide. So YMCAs would definitely be an ideal partner. They are a key partner across the state in the diabetes prevention programming work that is happening across the state and across the nation.
I would also invite you all to, if you have suggestions on specific partners, so that the YMCAs are a great suggestion. We have contact with WISE, as Gina did just mention. However, if there are specific partners that you're working with that you believe would bring some value add to the process, by all means, if there are some folks that you have, some very specific folks that you have in mind, you can actually give us the name. We may even reach back out to you to connect or introduce us to anyone that you might recommend. So thank you for that. If you have someone in mind, let us know.
Hello, Gina. This is Katrina.
Hi, Katrina.
I started thinking about this. Had you had the opportunity? There's a few other organizations that have a CDSMP, DSMP license. Have you had the opportunity to reach out to them as well?
Yes, we
in
have.
Pennsylvania.
Yep, we have invited all of the existing licensees. So that would be you, Department of Aging, Vintage Senior Services on the Western Pennsylvania, Health Promotion Council, United Neighborhood Centers, and then we have a couple of local organizations. Center in the Park is in southeastern Pennsylvania and one of our partners, as well as a couple of federally qualified health centers and community centers.
Okay, I assumed you might have, but I just thought I'd bring that up. Maybe
thank you.
Those
you so
as
much.
well. And there's also LifeWorks. Did you reach out to them?
Yeah, so they are the ones. They're in Erie, Pennsylvania. Yeah.
Yep.
Okay. So we do. So what we will do is make sure that they receive. So we received a mix of. We actually didn't receive many no's, that people didn't want to respond. Again, we realized the short period of time for invitation to this. So that's why we're utilizing a recording method to hopefully capture those who are not able to physically attend the live meeting. So we will be sharing this with the full invitation list. And one thing I want to point out is one thing that we can consider as a part of the sustainability plan is to make sure that we have a comprehensive list of potential partners that we want to explore their interest in implementing these programs. So even if they're not able to attend this actual group, that might be one of the outcomes in the plan to be included in the plan. Okay. So why don't we move on to meeting topics? I'm actually going to go ahead and back up to meeting number 2 and just see if we can capture any thoughts about what we would be presenting and what you want to hear about in meeting number 2, which is cost reimbursement and return on investment. I apologize if you're hearing background noise. We're in a fairly open, multiple conference room setting, and there's a little bit of an echo. So again, you have the slides, so if you have any thoughts that come up following the meeting, you can either email them to us or we'll be providing a follow-up survey to collect some of this information from you, or feel free to enter it into the chat box now. Meeting number 3, overview of best practices. And this is really to help describe what does a sustainable delivery network look like. So states across the country have been successful in identifying what makes a sustainable delivery system for these programs. So we'll be presenting those details to you. And we realize that this is a broad topic, but if there's anything specific that you would like to hear, or if there's a state that you know of that you would like to hear from, we can try and reach out to them and gather their best practices. Meeting number 4, sustainable marketing, promotion, and referral strategies. So in this meeting, we will be talking about various websites that have been developed for this type of programming, ways other states have garnered referrals to programs and utilized population health strategies, as well as targeted ways and best ways to reach older adults and adults with disabilities, as well as looking at other populations, because this does expand to beyond the older adult and disability population. So it has the opportunity to reach work sites and other groups. Okay, and I think meeting number 5 is self-explanatory. So, meeting logistics and strategy. Again, recognizing that we are conducting this process in a condensed period of time. Any feedback on suggestions on how we might reach more people? Do you feel that the recorded sessions and these live sessions, as well as recorded sessions, and having various ways for individuals to provide feedback is a feasible strategy? Our goal was to, we realized that, an ideal situation is to bring everybody together for maybe 2 days, present information, followed by a day of intense work groups where we develop this plan. Because of limited funding, and we are trying to reach folks from across the state, and realizing that time is precious to all of us, and we have other demands. This is, you're volunteering your time. So we're trying this route to see if we can utilize this strategy to develop this plan. Okay. Well, with that, our next steps will be our meeting on Tuesday, June 20th from 10 to 12 p.m. Again, we set aside 2 hours to make sure that we have sufficient time. We are utilizing less time at this meeting. We will be distributing the meeting recording and notes. We would like to send invitations to any new recommended partners following this meeting. So please send those along. And we will provide the detailed overview of Pennsylvania Community Living Initiative as a recording for all of you to share and to view. So at this time, I will allow for an opportunity for any input, feedback, thoughts. Okay, So at this time, since there are no other comments or thoughts or feedback, we will close the meeting, and we thank you so much for your participation, and we look forward to your continued participation in this process. Have a great day.
Thank you. You too.
Thank you.
Thank you.